Did you know that UTIs can become very serious if they are left untreated or not treated properly? If a UTI is left untreated, the infection can spread down to the kidneys, which leads to other life-threatening complications. That is why today I will be going over what are the main causes of UTIs, what are the symptoms that you may be experiencing, how we can prevent them, and how we treat them. So most importantly, I do want to start off by going over what is a UTI. So a UTI is also known as a urinary tract infection. This infection affects the bladder, the kidneys, and the urethra. Now this infection develops when bacteria enters our urinary tract, which leads to infection in our urinary system. Now you may be wondering, why does a bacteria enter the urinary tract in the first place? But it is common things that we may do daily, weekly, or even monthly, such as sexual intercourse, poor hygiene, feminine products, birth controls, using sprays or powders in the genital area, which leads to irritation, and as well as holding in urine when having to urinate can as well lead to infections. Now, how do we know if we have a UTI, or what are the symptoms that we may experience? The most common symptoms are pain or burning while urinating, pain in the lower abdomen, the groin, or the bladder, frequent urination or having that constant urge to have to urinate, but when you do use the restroom, nothing may come out or maybe even just a few drops. So as well as the urine may have a foul smell, or it may tend to appear a more dark yellow, very cloudy, or even sometimes bloody. So for example, I do have a healthy urine sample. As you can tell, it is a very light yellow, very clear, and we can pretty much see right through it. So again, this is a healthy urine sample. Now I do have another sample here of a patient who did have a UTI. So as we can tell the difference here, it is a lot darker yellow. It is very cloudy and turbid. We cannot see through this sample. So when I put these two side by side, you are able to tell the difference between healthy urine and urine with an infection. So if you do see big changes in your urine like this, it is very important to get in contact with your doctor so you can get treated properly. So with these symptoms, how are UTIs treated? UTIs are most commonly treated with antibiotics. A common medication that a doctor may prescribe to you is Macrobid. Macrobid is an oral capsule, and the dosage is 100 milligrams per oral capsule. So for your treatment, you are going to take one capsule twice a day, every 12 hours for 7 days. So that's one capsule twice a day, every 12 hours for 7 days. It is also best that you take the medication with food, as food helps to absorb the antibiotic better in the body. It also is very important that you take the medication the full continuous 7 days so it can cure the infection completely and prevent any other complications. Now, how can we prevent UTIs overall? We can prevent UTIs with common tasks such as urinating after sexual activity, remaining good hygiene, wiping front to back after using the restroom, taking showers instead of baths, limiting birth controls, feminine products, or switching them out. Anything that you may think that is causing you irritation, it is good to change it up. And these are some of the main preventions. So overall, it is very important that you do take good care of your health, as to prevent these infections from getting worse, as I mentioned in the beginning of this discussion. These small symptoms, they may start off as small symptoms, but these small symptoms may turn into something very serious, again, as I mentioned into the discussion. That is why it is very important that you have your checkups regularly, get tested regularly, and if you ever have any changes in your urine or changes in your body that you may feel is not normal, it is very important that you go get in contact with your doctor so you can get treated and diagnosed properly.